Imagine this for a moment. You're holding your phone, you open a message, but suddenly the text feels like it has moved slightly away from you. It didn't disappear, it's not fully blurry, it just stepped back. If you hold your phone a little farther, you see better, bring it closer. Worse, pull it back again, clear once more. Most people think, I'm tired, I didn't sleep enough, I worked too much today, but tiredness goes away, and the problem stays. This is hypermetropia, or farsightedness, a condition that can stay hidden for years, yet affects your quality of life every single day. Thousands of people struggle with it without understanding what's happening. Why do my eyes hurt? Why is reading becoming uncomfortable? Why does my vision get foggy in the evening? Today, we will break this down clearly, gently, and professionally, just like an ophthalmologist would explain during a real consultation. What exactly is hypermetropia? To understand hypermetropia, imagine your eye as a camera. There's a sensor. In the eye, this is the retina. Light must land precisely on that sensor. But with hypermetropia, the eye is slightly shorter than normal, so light focuses behind the retina instead of directly on it. It's like trying to take a photo where the camera focuses not on the object, but somewhere behind it. Because of that, near objects appear blurred. Your eye tries to correct this by tightening the focusing muscles, constantly, silently. When you're young, those muscles are strong and they hide the problem well, but every compensation has a cost. Eye strain, headaches, reduced reading comfort, fatigue. Why does hypermetropia become worse after 30 to 40? After age 30, the lens of the eye becomes less flexible. After 40, even more rigid. If you already had hidden hypermetropia, it now becomes obvious. People suddenly say, why do I suddenly need plus lenses? It didn't happen suddenly. You've been farsighted your whole life. Your muscles were just covering for it. Now, they can no longer keep up. How hypermetropia feels in daily life. Imagine a full working day, documents, phone, reading, computer. Every moment your eye muscles are working overtime. By the evening, something predictable happens. A foggy layer over your vision, burning sensations, eye heaviness, difficulty focusing. Sometimes double vision appears. Sometimes it feels like sand in your eyes. Sometimes the temples start to ache. If this sounds familiar, it's a sign you shouldn't ignore. Hypermetropia in children is even more serious. High hypermetropia in children can cause the eyes to cross inward. A child cannot focus on near objects, so the eye strains intensely. Sometimes the strain pulls one eye inward. This is how strabismus develops. If not treated in time, amblyopia appears, the lazy eye. The brain stops using the weaker eye, and vision drops. This is only reversible during childhood. That's why early diagnosis is crucial. The most dangerous form, hidden hypermetropia. This is the most common and the most exhausting form. A person sees well at distance, but their eyes get tired, sometimes terribly tired. Some blame stress, some blame dryness, some think it's just fatigue. The truth, your eyes are doing a job they were never designed to do. The muscles are holding focus all day, until one day they stop. Near vision becomes blurry, a fog appears, pain begins. People often say, my eyesight suddenly collapsed, but it didn't collapse. The compensation mechanism finally failed. What happens during long periods of near work? When you work at near distances for too long, three things happen. The muscles strain continuously. The lens becomes fatigued and less responsive. Focus starts jumping. This is the moment people say, I look, but I can't see. I'm trying to read, but the text won't stay clear. This is not aging, this is hypermetropic stress. How proper diagnosis is done. A simple eye chart will show nothing because your muscles can hide the problem. To reveal true hypermetropia, the focusing muscles must be fully relaxed using special diagnostic drops. Only then can we see the real plus value and understand the true condition of the eye. This is how diagnosis is done at Ko'z Nuri Clinic. Thorough, accurate, professional. How hypermetropia is treated. There are 5 effective treatment options. 1. Glasses. They relieve eye strain and make near tasks comfortable again. 2nd, contact lenses, perfect for active lifestyles. 3rd, eye exercises. They strengthen the focusing system and reduce fatigue. 4th, proper visual hygiene breaks every 20 to 30 minutes, good lighting, correct distance from screens. 5th, laser correction. For adults with stable hypermetropia, it can greatly improve quality of life. Hypermetropia is not just about vision, it's about comfort, about energy, about productivity, about your emotional well-being. A person with untreated hypermetropia feels tired more quickly, reads more slowly, loses concentration, and struggles with near tasks. All of this is fixable. Final message and invitation. If you struggle to see up close, find reading tiring, notice your child rubbing their eyes, or your near vision drops in the evening, this is not just fatigue. This may be hypermetropia. The earlier you diagnose it, the easier it is to correct. At Ko'z Nuri Clinic, we perform full, precise diagnostics, identify the true degree of hypermetropia, and create a personalized treatment plan. Your vision is your life's quality. Don't postpone it. Come to Ko'z Nuri. We will help you see the world clearly, comfortably, and without strain.